Hi, this is Dr. Jim Anderson from Anderson Podiatry Center for Nerve Pain, and as you can see, I'm standing right outside of our operating room here, and we're about to go in and do some nerve procedures on a patient that's suffering from quite severe restless leg syndrome. So very difficult here for him to sleep comfortably at night, symptoms of maybe cramping, pulling, anxious feeling where you have to get up in the middle of the night. Those are the kinds of symptoms that this patient has. But really what this video is more about is intraoperative nerve monitoring. It's something we've been doing longer than any other place in the country or the world, and we probably have been doing more of these than any other facility. A very few handful of facilities about the country do these procedures with nerve monitoring. So what you're going to be seeing in a minute, we're going to be in the operating room and you're going to see me demonstrating how we do this on our patients. Basically what I'm going to be doing is opening up some tight nerve tunnels, and before I open the tunnel I'm going to be stimulating the nerve and seeing how much of a impulse goes into the patient's muscle, and then I'm going to do it afterwards. So we can actually measure in the operating room the improvement that we're gaining for these nerves as we do our procedures. And actually helps, I think, with our surgical technique because we do it in this manner, and that's how it can benefit those of you that are listening if you're considering these kinds of procedures. So I'll be back with you in just a minute when we're in the operating room. We haven't really started the surgery yet, but these devices you see here, these are little needles that are placed in the leg. This is for one muscle group. These two go into a muscle here, and then there's two more you probably can't see very well on the other side. What we're going to be doing is operating on a nerve tunnel up here, higher up in the leg. It's called the common peroneal nerve tunnel or a common fibular nerve tunnel. And when I'm in surgery, I'll be using this little device. It's called a stimulating probe, and I'll be stimulating the nerve, seeing how much of a signal goes into these muscles, and then once the tunnel's open, we're going to do it again to see how much improvement that we gain. So we'll be back in a minute when we're actually doing the surgery, but this is the basic setup that we have for the patient, and they are numb, so they're not feeling any of this as we're doing it, and they are not feeling the probe. So we'll be talking to you in a minute. We have completed opening up this nerve tunnel, so we're going to check the final for this first muscle, and the baseline number was 11,900. So we're going to stimulate the nerve and see what we're getting. So we're getting 13,500, so that's almost 2,000 more. And now we're following up with Wade at 6 weeks from when he had surgery. His basic problem was he had restless legs, number one, and number two, he had drop foot, where he had weakness pulling his foot up into the side, and basically he's doing quite well, and I'll let him share a little bit of his story as to how he's doing now 6 weeks out, compared to before. So,
well, the restless leg has definitely improved. We've gone from keeping me up at night and kicking my wife and making her not sleep to where we're having restful nights, and that's probably about a 90% improvement there. So it still have a little bit occasionally, but it's definitely a major improvement. The drop foot definitely has made me able to walk, want to go for walks more, and enjoy life. So we're definitely in movement there, and I'm giving that about 80 to 85%. So it's been really good.
And two, Wade, you were a little. Some people have really bad drop foot where it's there all the time, and yours is more exertional, meaning the more you did, the weaker.
The more I did, the end of the day it got worse, and in the evenings and things like that. So it wasn't terrible, but it was definitely, I didn't want it to get worse. So didn't realize when I first came here that what we did, one treatment did fix both of them. So that was a major benefit.
Great. And so if I can kind of scan down there, may not see it too easily, but that's an incision there. These are nerve tunnels, folks. These are nerve tunnels that we opened up. The tunnels become tight, and especially this nerve tunnel, this is the superficial peroneal nerve, and the one up here called the common peroneal nerve. These two tunnels seem to be primary for restless leg, but also this one for drop foot, the common peroneal nerve. And then over here is another incisional area we gained access to a nerve tunnel back here on the back that affects the bottom of the foot. And that too can cause restless leg. This is called the soleal sling tunnel. So pretty much there are 3 nerve tunnels. Again, tunnels become tight, they damage the nerve, they're squeezing on the nerve, and we just get rid of that pressure. The nerves can work and function more improved, I should say, and help with the restless legs and the drop foot. So he's been great to work with. He's a great patient and a nice guy too. So we've enjoyed him, and I mean, he's 6 weeks out, and he should just continue to get better. So appreciate you sharing
Thank you.
this information. Thanks.